Welcome back to The Real Story, everybody. I'm Matt Caron. I want to get right to our second guest, the interim commissioner of the Department of Public Health for the state of Connecticut, Deidre Gifford. Commissioner Gifford, thanks so much for joining us. Always good to talk to you.
Thank you, Matt. Thanks for having me.
So there's a lot going on. The CIAC recently making the decision to cancel fall football season because they couldn't get the blessing of the Department of Public Health. There's been some protests. Students are saying, let us play. Your office has really been under a lot of pressure here. So anything you want to clarify about why the decision was made to not allow fall football?
Sure, I'd be happy to. First, I'll say to the student athletes and their families, we certainly understand the importance of sports to kids' physical and social and mental well-being. That's why DPH did make the recommendation that most fall sports were safe to play in Connecticut this year. CIAC did make the decision not to go ahead with fall football based on the recommendation that we made that it was a higher risk sport and should be either modified or postponed until the spring.
So you would have been okay with 7-on-7?
That was one of the modifications that we suggested, yes, and you can imagine why that would be a safer alternative, right? It doesn't have the close play and the tackling and the risk of spread through close contact like full contact tackle football does.
But Connecticut is in the minority on this, right? I mean, there's only a handful of states that are not allowing football in the fall, and there's other contact sports that are still being played here in Connecticut in the meantime. So what makes football different?
Well, what makes football different is the nature of the sport. And we did rely on the national organization to which CIAC belongs in formulating our recommendation, along with looking at CDC and NC2A guidance. There are a number of our neighboring states that have deferred football for the fall. So we're certainly not alone in this, and we're certainly not alone in our assessment that it's a higher risk activity going into the start of school.
Is there anything you're willing to reconsider about your position?
Well, we made a recommendation, and we have been consistent in all of our communications to CIAC, starting back when they first asked us for a recommendation around football towards the beginning of August. And we did suggest that higher risk activities for the fall either be modified or postponed. We continue to say to CIAC as recently as today that they should look at modifications or postponement of the season, which is what an option that many other states have looked to. And yes, there are states that are playing fall football. Many of them are making modifications to the game as well.
All right, I want to move along to a different issue. Deidre, there's strong support for wearing masks here in Connecticut. That's a great public health thing. But there's also a recent poll that found 20% of residents say that they don't plan to get vaccinated when a COVID vaccine comes out. What do you say to them?
Well, I would say that we have a job to do in public health, both at the state and at the national level, to ensure public confidence in a vaccine for COVID. We have an excellent track record of vaccine safety in this country and really around the world. And vaccines are a life-saving strategy for infectious disease. The world looks different now because of vaccinations than it would in their absence. And so many lives have been saved because of vaccines. So we need to make sure that this process is transparent, it's open, it's safe, there's no political interference, that science really leads, and we need to educate and re-educate the public about the process for developing the vaccine and its safety when it does become available. It should not be rushed.
Yeah, and there's a few Connecticut connections, too, in the race for a vaccine with Sanofi and Pfizer having some Connecticut connections as well. But Commissioner, I wanted to ask you this, too. When a vaccine does come out, do you think that it should be mandated for anybody who wants to go to public school? And I'm talking about either a COVID vaccine or the flu shot.
Yeah, so we haven't started talking about yet because we're still very early in the process of distribution strategy and understanding the risk of populations and the vaccine itself. We haven't really started to talk about the administration, although we are going to be doing that very quickly over the coming weeks and months. I think the federal government and the National Academy of Science and others are working on some prioritization strategies that we'll be looking at very closely. I think that high-risk individuals, those providing health care and other essential services, will likely be prioritized for the vaccine. So we will be following all of those recommendations along to see how they develop, and then formulating, working with stakeholders here, the Connecticut strategy.
All right, let me ask you this. You know, this virus has been ingrained into our consciousness for the last several months. We've certainly learned a lot about it. So that being said, how does what happened at the Three Rivers Nursing Home end up happening? That's over in Norwich, by the way. The deficiency report, I did read it. And I mean, we're talking about basic infection control stuff, not wearing proper PPE, not doing proper cohorting, not making sure quarantines were followed. How does that happen?
Well, there were clearly errors and lapses, as you say, in that facility. And it's extremely unfortunate, and unfortunate is too mild a word for what transpired there. The Department of Public Health has done over 2,000 infection control surveys in our nursing facilities since this pandemic began. We have been on site with facilities more than ever. We typically are on site only once a year in a nursing facility. So just since this pandemic began, we've averaged 10 visits to facilities. So, and in addition to that, you know, their own organizations have been working with them on training and infection control. So there were significant lapses at that facility. The Department of Public Health and our federal partners have taken enforcement action, and those enforcement actions are ongoing.
Deidre, it's been a few weeks now since powerful storms put many Connecticut residents in the dark for upwards of a week. Were there any public health ramifications that came from that? The governor, about a week or so ago, said that some areas of Danbury that were without power for an extended period of time were actually the same locations where they were seeing an uptick in COVID infections. Are we seeing a correlation between other communities across the state that were without power and now are seeing a spike in COVID?
We aren't, Matt. I'm happy to say there was some suggestion that the power outage was related to, you know, extended families and others needing to share closer quarters during the power outage, and that might have contributed to some of the spread. I'm happy to say that we've seen a couple of weeks of declining cases in Danbury, thanks to some great work by local health and local municipal officials in partnership with us and DEEP and others. But we have not seen other community spikes that appear to be related to the storms.
All right, and I know that one of the keys to keeping the lid on COVID is tracking the potential spread through contact tracing. So can you update us on that program? How has contact tracing been going for the state? Is that system working? Do you have enough people?
It's working well, and yes, we do. And I want to make sure to give a shout out to our partners in local health departments and health districts across Connecticut who are the leaders in contact tracing in most cases. They get the cases into our statewide system. They do the contact tracing and the case investigation. When there's overflow, when there's too many cases, we have a great volunteer staff, most of whom are professional students in training who have taken a course in contact tracing and really done a phenomenal job in serving the state of Connecticut over the past couple of months. And so we are reaching the majority of cases, the vast majority of cases within the first 24 to 48 hours after the positive result gets into the system. We're identifying contacts and reaching out to them. So our contact tracing system in Connecticut is going well, and we've been able to keep up with the demand given the relatively low number of cases that we've been seeing.
Deidre, less than a minute left, so I would just want to end it on this. I know you don't have a crystal ball, but what are you expecting here as we head into the cooler months, fall, winter? Science would seem to suggest this virus is able to live a little bit longer, transmit a little more easier in the cooler months. Do you think a second wave is going to be worse or better? What do you expect?
Well, as you say, Matt, it is hard to know. But I do know this. I do know that a lot of it is in our hands, that we have the tools to keep this pandemic at bay. And those tools are masks, they are physical distancing, they are avoiding large gatherings, and they are quarantining and isolating people that are infected or exposed. Those are tried and true tools, and they will get us through the winter if we stick to them.
All right. Interim Commissioner of the Department of Public Health, Deidre Gifford. Deidre, thanks for joining us. Appreciate it.
You're very welcome. Thank you for having me.
All right, and thank you for joining us on this edition of The Real Story. We will see you next week, and be sure to tune in to the Fox 61 News tonight, starting at 10. Have a great day.